Hey guys, Tuesday, 5th of May, and brief update on the viral situation before we go on to Dr. Asim Malhotra and then Dr. Campbell Murdoch. And they've done interesting television interviews and radio interviews on the crucial nature of metabolic syndrome, insulin resistance syndrome, in massively increasing the impacts of our current situation. So, very important stuff. But just a few verbal updates. So, the fourth vitamin D study has come out, human study, this time from India. So, we've had Philippines, Indonesia, USA study, and now India. And they are all showing the exact same thing. So, pretty much rough and tough, around 10 times the risk of serious outcomes or death when you have low vitamin D status, below 30 nanograms per mil, or that's 75 nanomoles per litre. So those are really, really interesting. They're associational, but vitamin D status does reflect insulin and leptin resistance and chronic conditions and autoimmune and many dietary induced conditions and metabolic syndrome. So the vitamin D is probably correlating so incredibly powerfully because it's reflecting the major drivers that lead to poor outcomes, poor immune system and poor outcomes. So that's one thing. On the social distancing or smart distancing, as I like to call my version, versus lockdowns, which are causing all of the economic damage, that controversy is still being discussed widely. And the latest is that around a dozen European countries are now pulling away from lockdown. Sweden, like many other countries, the death rates are coming down at the moment, and they have been for over a week. I think the peak was, and ICU loading, which never reached anywhere near capacity, has been coming down for a week or two. So that's great news. But of course, Sweden kept a consistent smart distancing rather than doing a full kind of lockdown. So it's going to be very interesting to keep looking at that data. And Israel are actually doing an enormous climb down from their very severe lockdown, which is quite compelling because they've only had so many weeks of lockdown, but now with the virus still prevalent and in society, they're really changing things and they're going to open up completely any travel restrictions. They're actually saying children can visit their grandparents who are the cohort at risk. And they are opening businesses, and next week they're going to even open gyms and all that kind of stuff. So again, it's a very interesting question. If the lockdowns had efficacy, how can you, after a few weeks, open them up completely when the virus is still clearly all around your country? So there'll be questions to answer in the coming weeks. So that's a quick update, but the really key thing is what is driving the massive impacts from this disease process. And metabolic syndrome, insulin resistance syndrome, leptin resistance, and all of these metabolic issues that our modern population is plagued with, they are causing much higher risk ratios for severe cases and death. And the low vitamin D, which I mentioned there, that's coming up in all the papers as up to a 10 times risk ratio for severe outcome and death. And again, it's because vitamin D status, as well as other things, reflects all of the problematic metabolic states that are causing poor immune function and the severe outcomes. So we'll now go to Dr. Asim Malhotra on India television station, and he summarizes really well. And followed by that, it'll roll into Dr. Campbell Murdoch, also in the Public Health Collaboration, phc.co.uk, and he has a nice radio interview there on the same topic. And again, we'd ask for the free content and all what we put out there, extratimemovie.com. After this passes, and with lockdowns coming down now, it's going to pass. What's really crucial is what causes vastly more death and suffering, and that's heart disease and Alzheimer's, modern chronic disease. So our movie at extratimemovie.com goes through how you identify and, crucially, with a high disease process going on, intervene, slow it, stop it, and even reverse it. So a fascinating movie. Really help us if you can share that site. So here we go, Dr. Asim Malhotra.
Definitely, there has been one factor which we cannot deny, that we do have more comorbidities in our community. So I spoke to Dr. Aseem Malhotra, who is a cardiologist, and he says that actually in the 21 days that we have, we can turn around our health. Let's find out from him how.
How can one reverse metabolic syndrome in 21 days? Well, first and foremost, let's define it. Optimal metabolic health is the absence of these 5 markers of risk. Number 1, having a systolic blood pressure of less than 120 millimeters of mercury or a diastolic blood pressure of less than 80. Number 2, having a waist circumference less than 102 centimeters if you're a man and less than 88 centimeters if you're a woman. Number 3, having blood triglyceride levels less than 1.7 millimoles per liter. Number 4, having blood HDL, so-called good cholesterol, greater than 1 millimole per liter. And number 5, perhaps most importantly, is having a HbA1c of less than 5.7%. In other words, not being pre-diabetic or type 2 diabetic. If you have any 3 of these factors, you come under the diagnosis of metabolic syndrome and are highest risk of death from COVID-19. But as I said earlier, the good news, you can reverse this rapidly, as my research and what I've seen with my patients reveals within 21 days of specifically just changing diet. What does that mean? It means cutting out high glycemic index carbohydrates. These are carbohydrates that lack fiber, and also cutting out all sugar and sugary drinks. So no sugary drinks, no fruit juice, no bread, no pasta, no white rice, and no potatoes. And instead filling up on full fat dairy products, oily fish, lots of whole vegetables and some low sugar fruits, nuts and seeds. And if you do this, I can assure you, you will see dramatic benefits within a very short space of time, within 1 month, to your health, sense of well-being, and your risk markers, and most importantly, reduce right now your risk of dying from COVID-19. So please, please, just do this for 1 month and see the improvements. And after that, of course, diet can be adjusted accordingly, and you can go back to eating some occasional treats.
Excellent advice, Dr. Malhotra. Thank you so much. I hope we all can follow this and turn around and change our life in these 21 days.
Let's speak with Dr. Campbell Murdoch, GP specialising in metabolic health and quality improvement trainer for NHS. Campbell, afternoon to you.
Afternoon. Thanks for having me on.
It's a pleasure. So people with poor metabolic health at greater risk. That's really the headline here, I guess.
Yes, that's right. So my big interest after being a doctor for nearly 20 years now has been in how can we really make a difference to our health? How can individuals be given the awareness, knowledge and support they need to be able to improve their health? And that took me into the remit of metabolic health. And in simple terms, poor metabolic health is a car that's not running well. It doesn't start well in the morning. Once it gets running, you're worried it's going to break down. When it breaks down, you go hunting for the problem and everything's looking a bit less. Versus good metabolic health is the car that starts first time. You want to drive at 50 miles an hour, it drives at 50. You want to accelerate to 80, it accelerates to 80. If it breaks down, there may be one piece that's gone wrong and you can identify that. What we now seem to have, and what's driven my interest, is after about 80,000 patient consultations so far, is the majority of what I see in my daily GP work is what I would probably put under the umbrella of diseases that shouldn't exist. So poor metabolic health being the trunk of the tree, the branches, so the diseases that shouldn't exist, are type 2 diabetes, fatty liver, non-alcoholic fatty liver, which now between a quarter and a third of the population have, high blood pressure, a degree of heart attack and stroke that comes with that risk. And with all of that mix, the bit that we see when we're walking around day-to-day life is obesity. And what I would say is obesity should not necessarily be blamed as the cause. Obesity comes with the rest of the body breaking down, and so is a real indicator that the body's not in a happy place. And certainly what we're seeing with the data with this study and the other studies coming through is the people that are at higher risk are the people with poor metabolic health. Hypertension seems to be a really big risk marker. But what's important about this is we can do something about it. Again, I spend my time on things where we can make a difference. And conditions such as type 2 diabetes, we now know we can reverse. I can get my patients off drugs within a week, blood sugars normalising, and patients losing weight, which is important for this discussion, in a sustainable, enjoyable way, really creating that win-win.
And in terms of the message, and this is what I've been confused about this for a long, long time. I mean, we live in this world, as I said at the beginning of this, where we have loads and loads of information about keeping fit, having a good diet, making sure you run, keep the heart going nicely, and yet simultaneously we have an obesity problem. I mean, how has that even happened?
Absolutely, it is astonishing. Taking it back to the most basic principles, the human body, us as humans, we're designed to survive and ideally to thrive. To survive, if we take a hit, we got to take that hit as best as we can and then repair. If we keep taking hits and or get less time to repair, we will break down. One message that lands with my patients very, very well is the concept of blood sugar. So we have to keep our blood sugar level at a normal level. That normal level is just 5 grams or 1 teaspoon in all of your blood, which is a very, very small amount. Now, if you challenge that day in, day out, that's challenging the body's ability to keep itself to survive, basically. It's like taking a hit. It's like a city under siege, constantly taking hits. Things go wrong, and that's basically what poor metabolic health is, and all the diseases we see, these diseases that shouldn't exist, are the body showing, I've been hit a lot of times, I'm trying my best to survive. And interestingly, obesity, so you've got fat under your skin and you've got fat inside around your organs. It's the fat inside around the organs that's the really nasty stuff. The fat under the skin is basically, in one way you can look at this, is the body trying to protect itself. You keep piling in this excess sugar and these excess refined carbohydrates, the body's got to keep the blood sugar level normal, and it does that by turning all of that excess sugar and refined carbohydrate into fat and using insulin, a hormone, to keep the blood sugar level down and push fat into fat stores instead. So what's wonderful is if somebody is interested in losing weight and they want to feel well, and potentially my big interest is helping patients get off drugs, is these are all win-win. The key is people need the right knowledge, and unfortunately we've had a few decades of unhelpful public health messaging around what's a healthy diet. And the reason I can say that with confidence is if I give my patients that information, they get sick and I put them on more drugs. If I give my patients information about reducing the amount of sugar, we know it's addictive for many people, so let's give you support. It may not be easy, but let's not base our foods on mountains of what we call carbs, so the stuff that turns into sugar as soon as you eat it. And what you see is within a few days, blood sugar levels normalising and weight's dropping off, hunger's disappearing, and people are feeling just a lot better.
And on that point, thank you, Dr. Campbell Murdoch, GP specialising in metabolic health, with us here on Talk Radio. Just gone 1:30. Let's get the latest news headlines with
Okay, so I hope you found those informative, and again, I'll try and share some of the better interviews on an ongoing basis. And finally, just ask again, you could really help us by sharing extratimemovie.com, because, as I always say, these things will pass, viruses will come and go, but heart disease and the biggest killers in the world will have enormously higher impacts continuously over time, especially with the metabolic disease we have in the world today. And the irony is it's so addressable if you only know the science. So extratimemovie.com, please don't just stream or download, that'd be great, but please also do share the site and recommend to your friends. And again, that will help us and keep the content coming. Thank you. Thanks for tuning in, guys. If you're watching on YouTube, you can see my subscribe button in the middle of the screen, and go to extratimemovie.com to see our fascinating new documentary on stopping and reversing heart disease.